Ms. Hudgens, slide number 21, talks about why we want the reform, what's the expected results. And it talks about a system that is efficient and provides better outcomes. Well, ladies and gentlemen, everybody's for that. Everybody's for a system that will provide a more efficient and better outcome. That is a great goal. It would also be a great goal for our communities to be safer. But what we're not going to do to reach that goal is to make every law-abiding citizen be inside their house by 9 o'clock at night. The proposed legislation does not match the need. This bill will not make it more efficient. It does not take the insurance companies out of the equation. As long as there's insurance companies in the equation, they will deny benefits wrongly. In a private meeting with the staff to discuss this, I asked them, do you expect this bill to stop insurance companies from wrongfully denying claims? And I was told that's a rhetorical question, because it won't. And as long as insurance companies deny claims, the system will not be efficient. We want to have a better system, but not by sacrificing and not by putting the reforms on the back of the Tennessee working person. What's going to happen if this bill goes through in its current form is that Tennessee workers are going to be railroaded by this bill. That's what's going to happen. There are barbaric changes to what the Tennessee working man receives under this bill. I searched for a word that would illustrate for you the level of cuts that's going to happen in this bill, and barbaric is the only. I thought draconian might fit, but it doesn't. Barbaric is the term. Under this bill, if workers go back to work after their injury, they're going to receive 25 to 42% less than under the current system. 25 to 42%. If they get fired after their injury, the worker's going to receive 60 to 75% less in benefits than the current system. When that happens, who's going to pay the mortgage bill? Who's going to pay the medical costs for the children? Who's going to buy food? Public welfare and assistance, TennCare, SSDI. That's who's going to bear the burden of these reforms if they go through in their current state. I want to talk about real people for a minute. This bill is going to impact, Chairman, real people in this state. Matt Webster was burned at work, and he's here today. Matt Webster's in the front row. Matt Webster was hurt in 2009. He's got a wife and 2 children. He is not going back to work. It was an industrial fire. And as you can see, his face is severely deformed. Under this bill, this man would go from making $50,000 a year and being out of work for 4 years now because of his severe problems and pain and mental problems with this. He'll go from receiving a one-time cash payment of $235,000 to care for his family for the rest of his life, to, under the governor's plan, receiving $56,000 as a maximum payout. That's a reduction for this man. This man in the room today of 76%. Another real person here today is Steve Wilson, also in the front row, from Mount Juliet. Steve Wilson worked as a plumber for 35 years, making $60,000 a year. He's got a 9-year-old daughter. He was terminated by his employer because of his restrictions. He has not gone back to work yet. Steve Wilson, under the current system, received a one-time payout of $200,000. I can tell you that without that money, Steve Wilson and his wife would have lost their house. The lifestyle they were living at $60,000 a year cannot be maintained when the governor's plan gives them a maximum of $32,000. That family, ladies and gentlemen, goes to the street. And that 9-year-old girl loses the home she grew up in. From $200,000 to $32,000. Is that fair, Mr.? Is that fair? Is that the system you want? That's not fair. That's a reduction of 83% for that worker. That's not always in the big cases. Let me show you an illustration of Tim Dunn, a 19-year-old college kid working at the YMCA, lived in Williamson County. He's a resident of Williamson County. He was making $235 a week as a camp counselor, fell and broke his arm really bad, had surgery at Vanderbilt. His medical expenses were $39,000. Remember I told you the problem with the system is what the doctors get paid? His medical expenses were $39,000, Representative White. He got $3,340 even though he was fired from his job as a camp counselor. He got $3,300. What does he get under the governor's plan? Tim Dunn gets $948. The medical bills wouldn't go down. The doctor would get $39,000. Tim Dunn, a 19-year-old college kid, would have got $900. That's a reduction of 72%. I provided to you, each of you, by hand delivery yesterday, an analysis of statewide data on how this law impacts real people. And I know you've read it, but if I could read every one of them, it's 65, 75, 88% of people who don't go back to work, that this bill guts what they get. Is that fair? Is that a fair system for employees? It's not. It's a windfall to insurance companies.